Are we ready to start? Being 8:15, I call this meeting to order, and we wanted to start early this morning because we have a couple of motions to deal with, so we wanted to get those looked after before our first witness this morning. So I believe we have a couple motions from Mr. Klees, and so if you want to start. And I'll just note, Mr. Klees, that you did have one motion to do with calling a witness, and that's I just want to note that you filed that, but it's not necessary because we'll just add it to the list of witnesses come before us.
But with regard to this witness, Will had said that he had a bunch of requests and he was going to explain who these people were and why they wanted to appear. And we'd asked for more information on who they were. Do you remember that email exchange?
Yes, this was one of the witnesses that had volunteered to come before the committee.
Yeah, and I think France and I had...
Oh, this was not.
Mr. Wade is one that who I called and asked if he would come. So this was not one of the volunteers, but I agree with you. We did say to Will that what we would want as a committee is a list of those names, some background on them, so that we can discuss what order of priority we would place on calling them.
And of course, Will is away with strep throat today, but I'm sure Catch may be able to fill us in. And of course, it should also be noted, I'm sure everyone did note that Will and his wife gave birth to a baby girl.
Oh, wonderful.
Yeah, so...
when did that happen?
So I don't know whether the strep throat is a result of sleepless nights since the birth.
My goodness.
Or what, but yes, so congratulations to Will and his wife. Audrey, I believe, is the name of their daughter.
Oh, wonderful.
Anyway, back to business.
So this Bruce Wade we're just adding to the list then?
Yes,
Sorry?
So
okay.
That's just added to the list, and there were some witnesses that had asked to come before the committee, and I believe Will was going to try to get some background information on those people for... Okay. We'll talk about that. So go ahead, Mr. Klees.
All right, I'll deal with the documents request. Well, actually, I have two of them. I move that the Standing Committee on Public Accounts here in the committee under Standing Order 110B, stating that each committee shall have power to send for persons, papers, and things, direct the Minister of Health and Minister of Finance, as well as the Ministry of Health and Ministry of Finance, to produce within a fortnight all correspondence in any form, electronic or otherwise, that occurred between January 1, 2007 and June 8, 2012, that mentions the following words, terms, and names: Mazza, Lapine, Ornge, Alfred Apps, Don Guy, Air Ambulance.
Any discussion? All in favor? Carried. Mr. Klees.
I move that the Standing Committee on Public Accounts, pursuant to Standing Order 110B, whereby each committee shall have power to send for persons, papers, and things, request a copy of any and all correspondence, including letters and or emails, from, to, and between Malcom Bates, Director of the Emergency Health Services Branch, and the following people: Ruth Hawkins of the Ministry of Health and Long-Term Care, Mary Cardos Burton, former ADM, Acute Services Division, Patricia Lee, ADM, Direct Services Division, and Fred Rusk, former staff member at EHS Branch, or any other staff member at the EHS Branch in which the reference is made to Ornge, or gives direction concerning the role that the EHS branch is to have concerning Ornge, or relates to allowing Dr. Mazza to do whatever he determines appropriate at Ornge and not to obstruct him during the period October 1, 2005 and the last day of February 2007, or makes any reference to how the EHS branch and its staff is to monitor, oversee, hold accountable, or reviews the performance of Ornge, and that said correspondence be delivered to the Clerk of the Public Accounts Committee no later than Tuesday, June 19, 2012.
Discussion? Yes, Mr. Zimmer.
Unlike the first motion that Mr. Klees did, which was quite specific, and it's easy to search the records because you punch in the names Mazza, Lapine, Ornge, Apps, Guy, ambulance and spits out the documents. I'm just concerned that I have a concern that whoever this document goes to, the motion to go and search for these documents, a lot of it's pretty subjective. Somebody's going to have to make some discretionary calls when they search the records. So how will they, the person or persons who have to act on this motion, there's a lot of sort of general stuff they're going to have to sort out. I'm just concerned about how that's all going to play out.
And I believe Mr. Bisson has a comment.
I don't think there's much in the way of the discretion. The standing orders are clear that the committee has a right to request papers, and if the names and the information that are contained in those records as per the motion have to be provided, there's no discretion.
No, I recognize the committee can order up the documents, and I'm saying, but when this motion or the order goes to the folks at Ornge, there could be some difficulty in interpreting just what documents they should pull out of the files and send us. So I don't want anybody getting in trouble at that end, saying
Mr. Klees,
they're going to have trouble
executing.
Chair, there is a very specific reason as to why I kept it as general as it is, and the reason is the very offensive letter that we all received from the Deputy Minister of Health last evening. I'll have much more to say about that letter, in which it's very clear that this Ministry of Health has no intention of cooperating with this committee in terms of producing documentation. And so, to Mr. Zimmer and to the rest of the committee, I just say, I think that the message has to go to the ministry that we want the documentation that's been requested, and if it's a pile, I'm happy to go through it. But that's the reason for the generality. I am very concerned about this letter from the Deputy Minister. And while I just noticed, Mr. Chair, that there was a typo here on this last motion.
Yes.
It should read February 2012, not 2007. I'm not sure how that date got missed.
So it should read the period October 1st, 2005 and the last day of February 2012?
That's right.
No. I just wanted to get. Are we on Hansard?
Yes.
Yeah, I just wanted to get it on Hansard that I foresee there may be a problem in figuring out, just what documents are necessary to comply with the motion. I anticipate it's going to be passed.
Mr. Bisson.
Well, for Hansard, I want to be very clear. The information they have provided is pretty specific within the motion, and it says if any of the words, terms, and names come up under Mazza, Lapine, Ornge, Alfred Apps, or
We passed that
well,
one.
on the other one, sorry. Same idea. Same thing is that the motion is quite explicit. It says if that information comes up, you're to produce it. There's no discretion as to which document, if it has 2 words or 2 sentences or 2 paragraphs about that particular subject, no matter, they must provide all the information.
Ms. Sanders?
What I was actually going to ask is how is that substantively different than the motion that we passed on, I think, May 30th?
It's substantively different because there are a number of additional names referenced there. And quite frankly, I'm willing to give the branch and the ministry one more opportunity to comply with this request because, and for the record, Mr. Chair, I believe that the Ministry of Health is obstructing this committee in our request for documentation. I will have some evidence of that, and we'll deal with that at another time, but I can tell you that the Deputy Minister of Health has some explaining to do with regard to this letter that we received. And I just like to suggest that the motion that I put forward has been worded as it is for a very specific reason.
Okay. Any other discussion? Okay. All in favor? Opposed? Carried. Okay, and we have another motion from Ms. Sandals.
Yes, and I don't want you to accuse me of filibustering, so I'm wondering, Clerk, if it's possible that, is there some way we can make reference in the motion to the attached list instead of reading this all into the record?
I'll get our clerk Catch to
You can move the motion.
You
You can move the motion if a member of the committee asks that be dispensed.
So
then
if I
will
start
capture
into
it in the
first
minutes.
2 or 3, you will say, I invite you all to say dispense, please. Thank you. No, you need to let me get into about 2 lines of the list and then say dispense, and we'll all be happier. Okay, that pursuant to Standing Order 110 sub B of the Standing Orders of the Legislative Assembly of Ontario, the Standing Committee on Public Accounts request a copy of any document referred to directly or indirectly in the following time dockets from the report entitled Time Docket Report Raw Data between 02/01/2000 and 05/28/2012. Produced by Lynn Golding, partner Fasken Martineau de Moulin LLP, and that the documents be produced by no later than July 13th, 2012. Time card index 1558553, dated 01/06/2003. Thank you.
Okay, any discussion on this motion? All in favor? Yes.
I just want to be sure that, so we're asking for any document referred to in those, but they would not necessarily be documents by Lynn Golding, because sometimes they refer to documents that, she refers to document that has nothing to do with her, kind of.
If I may, what we got was the billings for Faskens related to Ornge, and it's quite specific. This is not all the billings for that period, which is why we've got this lengthy list, but they are billings in which references are made to documents. So a document was prepared, a document was discussed, a document was sent, something like that. So in each of these billings, there's obviously some docket, which is, in the roundabout way we discussed, being produced at public expense.
Perfect. So it's all encompassing.
Yeah.
Okay.
Okay, all in favor? Carried. Very well. So, yes, Ledge Research had asked last week for an opportunity to update members, so this would be a good time, Ray.
Just a few minutes of your time, if I could. And we've discussed a bit, I guess, in subcommittee that my role, Ledge Research's role, has been somewhat different on this committee. And I think that looking at Liz and Mr. Zimmer and maybe Mr. Bisson, the way we've approached reports on this committee over the last couple of decades, but nevertheless, we're into new territory here. And I have to be as helpful as I can to get us through this new experience. In subcommittee, I guess, going back a couple of weeks ago, I thought a bit about it, and I thought to myself, probably the most useful thing that I could produce kind of at the end of this spring session, as of today, before we go into the summer session, is to look at the documentation, essentially to go through Hansard, and I think Mr. Klees had made reference to the importance of doing cross-referencing to Hansard pages specifically, but to go through kind of issue by issue for each witness, And it's a long process because we're dealing with, I don't know, 50 or 60 individuals. But to go through by individual and issue by issue and essentially take the committee's issue and the response from the witness as to their position, so we can go through kind of item by item by item. Another option is to kind of take all of those responses by issue if it's the bond, and wrap and kind of parcel those up. But at least it seems to me that at the end of the day, we would be able to go through that 50 or 60 page document, or you would, and it would help us kind of get to the next stage. And the next stage may or may not be a report. And at that point, and through Liz, at that point, we'd start to talk about recommendations and say, Ledge Research should construct a report essentially addressing these recommendations. So this would be an interim document, and I think it would tend to kind of, I think, shake out who said what about what given issue, if it's the bond or if it's aircraft safety or if it's purchases or what have you. So if any ideas on that to make it more useful would be helpful to me.
4 people that want to speak, so Mr. Klees, you were first with your hand up.
With page references, as Mr. Klees had pointed out before.
Yeah, I like that direction. I think it makes good sense. I'd ask for one other component to that, though, if you could, and that is also in those sections, the subject matter that's being addressed, whether it's oversight, whether it's marketing agreement, or whether it's paramedics or so on, that you also reference the Auditor General's report and the pages of the Auditor General's report under those particular headings, because at the end of the day, what we want to do, obviously, is tie that all together. And so that would be very helpful.
Very well. And Ms. Sandals?
Yeah, and actually I was going to make the same suggestion, and just to be clear that we're going to do this by issue, because the transcript of an individual witness we can get from Hansard, it's when you organize it by issue that it becomes useful to us, because then we've got all the conversation about one issue in one place. So that reorganization is where your work becomes really useful. And I agree that we should start with the auditor's commentary on whatever that issue is.
Yeah, and I think with respect to the auditor's report, I'm just trying to, just to make it somewhat manageable so it's not too long, is probably to make reference specifically to recommendations. I wouldn't want to put too much of Mr. McCarter's information in, but at least we have the reference in the section, and maybe just to focus on the recommendation. Maybe if that would be adequate, I don't know.
Well, or could you at least reference where he's raised the issue?
Yes.
So I'm thinking in, like, the Augusta, I think the auditor, if I recall, raised the issue of this controversy over how much they should be paid for, and the fact that this seemed to match up with the marketing agreement. I'm not sure you made any recommendation, but it would be useful to know that the auditor has noted this as an issue, even if he didn't have a specific recommendation.
There would certainly be issues in the report where we wouldn't necessarily have a recommendation. A good example would be the salaries, where we raised the issue of the salaries back in September with the ministry, but by the time we issued the report, it had been addressed. So I would agree with Ms. Sandals. There could be some issues where we did comment on the report, but we may not have had a specific recommendation, but it might be worthwhile for the committee to just notice in Legislative Research's report that the auditor expressed concern about whatever
Exactly.
it was.
Okay, so that can be cross-referenced then, without, just so that you can know that what page to go back and what section to go back.
Give us a couple of sentences in the cross-reference back to his report, and then the cross-references back to Hansard for the witnesses.
Okay, and I think the other thing that I would, as I was kind of working through it in my mind, the other thing that I think is helpful is to provide details on, as we would in any other report that you would know, Liz, that we provide a list of constructive initiative undertaken by the auditee with respect to Mr. McCarter's report. And I think that to give them, in the front of the report to specifically say, and they did a reasonably good job of listing all of the steps they've taken. I think it's important to kind of balance that off before we kind of get into the testimony section, so that it's anyway.
Sounds good.
And Mr. Zimmer, you had a comment?
My points have been covered.
Okay, and Ms. Jellens?
I'm just throwing it out there, and you certainly don't have to go with this, but I think it would be useful. We did that in the Select Committee for Mental Health,
Right.
to do a report that is what we heard. So it would not necessarily show everything that the ministry has done. I think in the final report, it could be done, but because this is such an extensive number of witnesses coming forward, everything stayed as what has been stated this morning. Some of the headers from the auditor's report are very appropriate as to here's what we've heard, and do the reference, and do all of this. In some of the element, we heard, like a number of witnesses all going the same direction, and then a number of witnesses telling us exactly the opposite. So you can certainly regroup this under the headings.
Right.
But the document you would produce for the end of this session would be strictly focused on witness testimonies of what we've heard. And this would be a document that would be produced that everybody could read, that would be separate from, at the end of this all, here are our recommendations that would be more focused on the recommendations that the auditor has done. Just for ease of use that I'm putting this out. I realize that we've never functioned this way at the public account, but I think it has value.
So if maybe I just respond to that. So really, with respect to the testimony from Ornge and from the ministry, you're suggesting that particular response would be something that would deal with later on in a report.
The testimony of the ministry, certainly, because they came and testified, would be
Well, that's what I'm
be
thinking.
included.
That's what I was thinking. Yeah.
But the written response that usually happen, like the auditor made recommendation, submitted it to the ministry. The ministry responds to it. I think this will come in our final report. But what we would do in the interim will be focused on what we've heard.
And that's I'm in agreement with that, and that's what I understand this document to do, as essentially to collect up those responses to issues identified by this committee. So I think we're on the same wave.
Okay.
But my concern was I thought we weren't clear with respect to testimony received from the deputy minister, and when I was speaking with Ms. Sandals, I was saying that should be part of this backgrounder.
Yep. Yeah.
So
okay. I think we're all on the same wavelength, and if I know it's none of my business to tell you how to do your job, so we'll take it as advice, and you can do with it whatever you want. Try to make it the read of the thing as easy as possible. So the referencing, please put it in footnotes at the bottom, so that when somebody reads it, we're not forever interrupted in our reading with parentheses of witness and the dates and the answered and all of this. If it could read easy with kind of a footnote 1, 2, 3 at the bottom, and at the bottom would be
for answered references.
Answered references, as well as if you're referencing the document of the auditor or anybody else. But when we read the document, it would be a summary of the testimonies, and the background information as to would be at the bottom in footnotes at the bottom of the page where you make reference, just to make it easier to read.
We won't debate the footnotes, but I would say this though, that because I'm going to be using a lot of footnotes, I don't want to. What would happen? I'd end up with a large chunk at the bottom with maybe 30. My preference would be to, at the end of a summary statement, to put brackets and just put H Hansard -32.
Okay.
If not, I'm going to end up wasting a lot of space.
I trust you. As long as when we read it,
you'll know where to go back. You'll be able to go right back to Hansard, and in some cases, I may use a direct quote. Hopefully, I won't have to do that, and I can just paraphrase and essentially say the witness discussed response with respect to the bond or safety on this page. Mm-hmm. The critical points were kind of A, B, and C. and you can't, because we're going to be dealing with about 500 pages of testimony, we've got to reduce it down to 50. So we're really going to have to condense it as best as possible. But anyway, I think that's probably...
Okay, and
thank you very much.
Do you still have a comment?
No, the only point I was going to make, just to help Ray out, is just whether the committee wanted like exact quote, like let's say you're talking about the dispatch system or the marketing agreement. Did the committee want exact quotes from here's 4 or 5 things, Mr. Smith said, or did the committee want Ray to try to paraphrase that? Just trying to help, just...
No, I appreciate that. I think that, as I say, I have to go from 450 pages to 50. So in some instances, as I said, I may do a direct quote where you couldn't possibly improve on what was said. But if I can paraphrase, essentially saying the witness discussed the issue of the bond and the ministry's position is X. So to try to be as tight as possible. And then I'll have longer notes that I'll be able to go back and elaborate. If you say, let's elaborate on this, I'll be able to do it. But I have to bring it as tightly as possible.
Yep. Ms. Sanders.
I was just going to comment that, like, I know what France is getting at in terms of the way we did the select committee as a two-parter, but I don't actually see this as a draft report.
No.
I see this as a research document so that we can start to organize our thinking. So I'm not expecting it to look like a draft report. No. I'm expecting it to help us organize all this information we've collected.
Yeah, it really is a checklist,
yeah.
I think, for us, because clearly before the committee, if it decides to write a report, it has to answer certain fundamental questions with respect to this service in Ontario, and and there have been varying opinions on that as to what it's going to look like for Ontario going forward. I think we're probably away from actually making comments on that, but I'm in the committee's hands. Anyway, if hopefully that captures it. If any other great ideas, please let me know and we can shape it a bit and change it and so it's useful. Thank you.
Yeah. Okay, and I think we're pretty much ready to start with our witness for this morning. So Mr. Fred Rusk is here. Welcome to the committee, Mr. Rusk, and thank you for coming in. And just to confirm that you received the information for a witness coming before the committee. Very well, and our clerk has an oath or affirmation for you, whichever you so choose.
Mr. Rusk, if I can ask you to raise your right hand. Do you solemnly swear that the evidence you shall give to this committee touching the subject of the present inquiry shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you.
Very well. And you have some time for an opening statement, and then we'll have time for questions amongst the three parties.
I really don't have an opening statement, I'm afraid, but please feel free.
And then we'll start with the official opposition, Mr. Klees, and we'll have 20-minute, roughly 20-minute periods of time.
Mr. Russ, thank you for coming here today.
You're welcome.
Appreciate been looking forward to having a chance to discuss this file with you. I understand that you were actually, can I use the term, the founding father of Ontario's helicopter EMS service?
You might want to call me that. Back in 1977, I guess it was 1976, I was asked to be a kind of a technical advisor to the ministry on the concept of an air ambulance to support the Sunnybrook Trauma Center, which was, I guess at the time, was the only trauma center in Ontario. And myself and another chap looked at different companies and other services, I guess, from around North America. And we came back and gave a report, and from that the ministry decided to have an RFP to have a helicopter support for Sunnybrook. And in 1977, that contract was won by a consortium of 5 helicopter companies, and basically melted down to the now Canadian Helicopters, which was a number of different companies involved over the years before they became Canadian Helicopters. So I guess if I'm the father, thank you very much.
Well, it's interesting because when Ornge went out to the market with a very large bond offering, if you look at that offering memorandum, I don't know if you've seen it, but it repeatedly makes reference to the excellent reputation that Ontario's air ambulance system has worldwide.
Correct.
And although it was claiming that, of course, for itself, it didn't have any history at that point. The only history that it had was Ontario's air ambulance system, which is the one that you initiated, and I'm assuming provided leadership to over the course of those years. So 1997 was the year that it was launched.
77.
1977.
October
right.
77.
And so what was your role then in that unit? If you can just give us some sense of your role and also tell us something about the unit of people that you then put together to help manage that.
Well, my role ended after the award of the RFP. At the time, I was asked if I'd like to be in charge of the air program at the time, or take another position within Emergency Health Services in Eastern Ontario as a regional manager. And I thought, well, I'd been in the ambulance service for 7 or 8 years now, and basically working on an ambulance. And I thought this would be more to my liking, so I went to Ottawa, became the regional manager for Eastern Ontario from 1977 to 1982. And I guess during that time, the program as it started was a pilot program, and there was some talk of it being disbanded until I think there was a huge bus crash in the Barrie area that involved a lot of children, a school bus crash, which the single helicopter, it was a Bell 212, it was a fairly large helicopter, transported a lot of these kids to the roof of Sick Kids. Sick Kids at the time was the only one with a helipad on the hospital for sure, and probably the only hospital in Ontario that had a helipad at the time. So I went off to Ottawa and worked in Eastern Ontario for 4 or 5 years. From that, I was asked to transfer as a regional manager to Eastern Ontario, Central East Ontario, which the office was in Barrie. Looked after the City of Toronto and basically Durham, York, Simcoe County, up to Parry Sound, I guess, and Alliston Way and over that way. And I was there for 9 years. During that 9-year period, I took part in the evaluation of the, I guess you'd call the permanent helicopter program. Forgive me, I can't remember the years, but it was during those years I was in Ottawa and in Central East Ontario that I helped with the preparation of the RFPs and on the evaluation of the submissions of the RFPs at the time. Other than that, the only other involvement I had was the other job that I had with Emergency Health Services, and that was I was the VIP Health Services Coordinator for the ministry, and that was a wonderful experience that I had, preparing medical plans and working with the RCMP and the OPP, and looking after or making plans and looking after, in certain cases, heads of state and the royal family. I did that for about 19 years as a kind of a, you're going to be doing this, would you like to do it? And I said, absolutely, so I did it. The program itself went from a single helicopter. It was stationed in Buttonville. That's where the companies that bid operated out of, and that's where all the maintenance was done on the helicopter as well. And they had a single, twin-engine Bell 206 as a backup, which is a very small helicopter, and it wasn't appropriate. But the program started to expand. I was asked to come in and look at the expansion again, and we had all kinds of consultations on where they should be. And the helicopter program started in Toronto, and it went to Sudbury and Thunder Bay. And they were the three main helicopter bases at the beginning of the program. At the same time, all along, there were a number of private air ambulance companies, I guess, air companies, that provided service for fixed-wing airplanes, long range. And then it was decided that we should probably have a dedicated fixed-wing service. And I took part in that. And actually the two bases that were started up were in Timmins and in northwestern Ontario. I'm sorry, I can't remember the name. Fort Francis, I believe. Okay. That contract was won by I think the forerunner of Air Ontario, actually. They had two Citation jets that operated out of those two bases. So the program grew from 1 to 3 helicopter bases and 2 fixed wing. Now these were dedicated programs that were all won by RFP and were staffed by, they were actually staffed by Ministry of Health paramedics. As you can imagine, the start of all this, there really wasn't, quote, paramedics in Ontario. I was fortunate enough back in I guess in 72, 73, to take part in the forerunner of this type of program for advanced care paramedics. We were called AMEs, EMAs, Emergency Medical Assistants, and it was basically, I guess it's probably more like a physician's assistant type of course. And at the time I was selected to do it, there was only, I think it was about 40 of us that was trained in the province back in the 70s. So consequently, I was a multi-engine pilot as well at the beginning of all this. I had aspirations of flying the big stuff. But I got hooked into the ambulance service and enjoyed it all my life. And here I am today, I guess.
Appreciate that background. Can you describe for us the Emergency Health Services branch and its role in overseeing that air ambulance operation? What did that look like?
Well, after I moved off to Ottawa, the fellow that I worked with that did all the groundwork for it he was the manager of the program for the first couple of years, I think. There was a lot of groundbreaking things that took place, and that was the training of these air medics by Sunnybrook. Very intensive training because there wasn't anything available at the time. They were the first base hospital in Ontario as far as delegating medical acts to the paramedics. The first people we hired were a mix of nurses and I guess actually there were some people that went on the course with me that worked there for quite some time actually. So they were constantly being trained to do more and more and more until today, where they're what they do is absolutely fabulous. I mean, they're really. I mean, I guess the line is the sandwich between the meat, where these men and women take the sickest of the sick and transport them between hospitals and go to scene calls from car accidents. And I'm sure Many, many, many lives were saved at the time. Now, the overview of the program was the Ministry of Health Emergency Health Services branch. I had spotty interjections because of my experience with it and my knowledge of airplanes and helicopters and so forth. But there was a section now in emergency health services called the AIR program, and it had like I say, had a, I don't know if he was, it'd be on the same level as a regional manager, I suspect. But the gentleman that ran it for many, many years, and who's passed on now, his name was Hank Brown. He was a colonel in the Canadian military and very knowledgeable about air transport. I think he was in charge of the air transport division at Trenton for a number of years. And he and a number of people in the branch looked after the air program. Because then there were managers at each one of these bases that looked after the staff, if you will, and the affiliations with the then base hospitals for the air program in the local communities.
So that
the funding came from
that air program section of the Emergency Health Services branch had the responsibility then from the ministry's standpoint to oversee
correct
the air ambulance program of
correct.
The province. Is that correct?
Correct. It is correct. Along with the Ministry of Natural Resources, they're the lead ministry for the Ontario government and for aviation.
On the aircraft side, right?
Correct.
Right. So moving forward then, that would have been the structure that was in place when the government started to think about restructuring that air ambulance program.
Yes.
Were you engaged in any way in those discussions early on when the government, if I recall correctly, was responding really to some reports that had been done that pointed out that there were some weaknesses within the system in terms of some of the connectivity, communications, and so on, that there was a desire to streamline the system, and that a number of different options were under consideration. Were you involved in any of those discussions? Given your background, were you drawn into that discussion to get your advice in terms of what the best structure might be going forward?
No, I wasn't asked that at all. I guess I should have told you earlier that I managed the AIR program from 1995 to 2000. I was the manager of the air ambulance program in Ontario. And after that, I became the senior manager of operations for the branch. The talk about the air program being devolved from, if you want to call it that, from the government, I think started in 2003, if I'm not mistaken, or early 2004. I'm not quite sure. I wasn't involved. I wasn't asked my opinion on about what I thought. Actually, I probably was asked, "What do you think about this?" But was kind of not an official thing. But what do you think? And at the time, I didn't think much of it because the government had downloaded the land ambulance system to the 51 upper tier municipalities, and I thought, well, this is the way everybody's going. So with that, that was it. I mean, I do recall there was a standards committee, CAMES, that come and do an audit. And I do recall some of their comments saying that it's fragmented and it's not something that although they passed the accreditation, it wasn't something that they thought was feasible. And at the time I thought, well, I mean, it's been feasible since 1977, so, if it ain't fixed, if it's not broke, why fix it? But that was all my involvement. I wasn't involved in any of the discussions or plans of this takeover or whatever you want to call it, but that was it.
While you were the manager of the air program from 95 to 2000, how many staff did you have in your section?
Just at head office? Just at head office, because there were managers at each one of the air bases.
Well, let's start with head office, and then give me your total complement of staff to run this program.
Well, I'm just trying to think now. I'm trying to put some faces to names here. There probably was about 7 people at headquarters with access to the financial side of things, to the legal side of things, to the ministry's medical advisors sort of things. They weren't obviously reporting to me, but about 7 or 8.
What was your budget?
Oh, God.
You don't have to be to the dollar, just when you left, 2000, what would the budget have been for the air ambulance program?
Maybe 90 to 95 million, I suppose.
Okay.
The biggest chunk of that was the helicopter contract.
You have a couple minutes, Mr. Klees.
Okay, I'll defer to my colleague. I'll pick up the rest of my time next time. Thank you.
Very
Appreciate
well.
that context.
You're welcome.
Do you want?
Ms. Jelinek?
Pleased to meet you, Mr. Russ, and thank you for coming to Queen's Park. I will also take you down the memory line. We have you on record, just because everything is on record here. The Auditor General had done an audit of the ambulance system, which at the time included the land ambulance and the air ambulance. It's a special report that the auditor had done, and at the time you are listed as the manager of the air ambulance patient care and program standards section.
Okay.
It was quite impressive as a title, wasn't it? And we're on December 14 in the year 2000. So from what you have told us, I'm not sure, did you leave the ministry in 2000 or in 2003?
It was in June of 2004.
Oh, in June of 2004.
Yes.
So from 2000 to 2004, what did you do?
I was the senior manager of operations. Right, I'll get my years straight here. I left in 2004. So for from 95 to 2000, I was a manager of the air ambulance program, and then from 2000 to June of 2004, I was the senior manager of operations for the branch, as well as this VIP health services coordinator.
As well as the
VIP health services coordinator for the ministry.
Okay. So when you say for the branch, you're referring to emergency health services branch?
I am.
Okay.
Correct.
And when you also happen to be working with Malcom Bates during that period of time.
That's right.
Do you remember what Malcom was doing?
I think he was the director of the branch.
He was the director of the branch.
Yes.
Okay. So you were I thought you told me you were the manager of the branch. Say that again.
No, Malcom Bates was the director of ambulance services branch.
Okay.
My job in the last 4 years or 3 years that I was there was the senior manager of operations.
Okay.
Under Malcom, there was the senior manager of operations, all the regional managers, the manager of the air program, I believe, and then, down the ranks.
Okay. So did you report directly to Mr. Bates?
I did.
You did? Okay. All right. But from 2000 to 2004, you are no longer involved with the air ambulance. Somebody else has that job.
That's correct.
Okay.
Well, when I say involved, I don't know, understand what you mean when you say involved. I had an affinity for it. I always was involved, I felt.
Okay. But your job as manager of operation, did operation included both land and air ambulance?
Of course.
Okay. I just have a hard time understanding the structure of it all. So coming back to a question that my colleague had started to ask you about, who was responsible for the oversight? And I'm mainly interested in the air ambulance section of it. I'm not interested in the person, as in, was the oversight all within your branch, the Emergency Health Services branch?
Up until the point that it was released. Always.
Always. And how was the oversight done? I know that because I read some of this thing, it's 12 years old, so I don't expect you to remember, but you talk about a number of standards that exist. Standards for time, standard for training, standard for a number of things. How was that handled within the ministry, the oversight of air ambulance to make sure that we get good service?
Well, we had our own managers at the base, for one thing. We relied heavily on the Ministry of Natural Resources to do operational audits of
So own manager at the base, that was employees of the Ministry of Health?
Yes.
Were at every base, that is every hospital base?
Every dedicated base.
Every dedicated base?
Yes. There was the 3 helicopter bases, the 2 fixed wing, and then later on, one of my jobs when I first became the manager of the program was to basically implement the 27 recommendations of the Gail Donner report. There was an extensive report done on the air ambulance program on forgive me, I can't remember all the recommendations, but I do remember 27 of them, and a lot of it had to do with the disbursement of the regions of the province for the private air ambulance operators to have their contracts and where to position the bases. As I say, the Ministry of Natural Resources and myself at the time of being the air manager were involved in investigations of complaints. There were hard landings, things that happened to aircraft in the air that we investigated and did reports. But I think I understand you that the program was managed and overseen by the branch.
So part of your management and overseeing is that you had staff at every one of those dedicated bays.
Correct.
And how did that bring value? How did that help you oversee and?
Well, the day-to-day operation, making sure people were there and attendance and they got paid properly and their benefits were looked after, anything that would come up at the bases. The other thing I'd like to mention is that during my tenure as the air ambulance program, the helicopter program expanded to 4 additional bases. That was a result of the Donner report. One of the recommendations was, because there was dedicated air bases, there were 5 at the time, and there were a number of private air programs that were on standing offer agreements with the branch, with the ministry. The Donner report recommended the consolidation of that, because these 4 bases that we expanded to after that were helicopter standing offer agreements. There was one in Ottawa, there was one in Smith Falls, there was one in London, then there was one in Kenora, in Moosonee, sorry. And we decided to make them dedicated bases. There was an RFP. Canadian Helicopters won the RFP, and we established the bases in Ottawa, London, Moosonee, and Kenora. And between those years, I'm sorry, I can't remember the exact year.
It's okay.
But the managers, so there were managers at those bases too. They dealt with the day-to-day work at every base. whether it was making sure that the helicopters were, and fixed-wing airplanes were properly staffed, equipped, clean. They took part in arranging for continuing medical education to the air paramedics, along with their base hospital, and whatever, they were the local manager. They dealt with the local hospitals. They dealt with the local ambulance services with regard to coordination of the land and the air, and that's about all I can think of right at the moment.
You made sure that it worked. And I want to fast forward you. I take it you read the papers just like everybody else. You know why you're here. You're here because well, I'll tell you why. The Auditor General did a special report. He went and did an audit of it's now called Ornge Air Ambulance, I'm sure you know.
Yes.
He did an audit of Ornge Air Ambulance and related services and found a number of, I would say, questioning endeavors going on at Ornge. Have you been following it in the news at all?
I wasn't till somebody called me one day and said, "Have you seen what's going on at Ornge?" And I said, "No." I guess there was a lot of reports in the Toronto Star. Mm-hmm. So I have been lately.
Okay, so I'm now fast-forwarding you forward. So you knew the system when the government ran the different dedicated bases, where the government had a manager on the ground and basically was the supervisors to the different people working. We're all working for the government. And then there was those contract, what you called standing offer agreement, with air company that provided the aircraft.
Sure. We had there was three different types of contracts: the dedicated program,
okay,
the standing offer agreement program, and then the organ retrieval program. There was three. The organ retrieval were basically you could use any of those helicopters, airplanes, whatever. But basically, there were additional companies that provided jets because they'd run to California or out west or wherever, but within a 5-hour range of Ontario for organ retrievals.
And you had agreement with those different companies to go retrieve something that was a little further?
That's correct.
Okay.
That's correct.
In a 5-hour flying range, you go far?
Yeah. Well, Vancouver anyway, and Loma Linda, California was the farthest I think we ever went.
Okay. So
I should just mention one other thing. During the time I was with the air program, one of the RFPs for the dedicated program was the I don't know what the word is, but the employees, the paramedics of the Ministry of Health were let go from the ministry and picked up by the dedicated air operators. So they were employees of the air operator. Okay? So we didn't have any paramedics that were our employee running on the airplanes, nor were the pilots, and nor were the aircraft ours. We just ran the RFPs, oversaw the operation. I dealt with Transport Canada on different items, providing, when they were rewriting some of the air regulations and that, we provided people to give witness at these air regulations for the air ambulance so that we weren't charged tariff fees by the air traffic control people. So we kind of had a pass on all that.
And how did you make sure that those private operators did have paramedics and that they staffed them properly?
Service visits. We went there. They provided us names, and all the paramedics were registered with the branch. today. Every paramedic in the province is registered with Emergency Health Services. They're the governing ministry, if you will, that look after the Ambulance Act. So all those, all that information is gleaned from the colleges, the community colleges, and all their.
So you knew how many staff had
Yes.
been employed by the different.
Yes, we kept a list.
Yeah, and did you make sure that they were not only employed, but they were deployed, as in they were available, and was there any kind of accountability agreement to make sure that if you're on a dedicated base, you have staff on hand?
Yes.
How did you do that?
Well, the policy was that obviously if you have an air ambulance and it's going to pick somebody up, there had to be at least one person in the back. That was the policy, the medical policy. And the policy of our branch. I guess we did what we call ramp audits. I did them. Our investigators at the branch did them. Transport Canada did them on any of the aircraft to make sure that. And of course, our dispatch system was controlling it all, and we kept a list of who was flying that day, who the co-pilot was, who the paramedics were in the back, what shifts they were working. All this information was made available to us, and we did spot checks and audits. In fact, at the time I was with the Ministry of Health, we had our own audit branch, and I don't think they have. I could be wrong. I don't know. But our own audit branch did audits on both the land and the air programs.
Because you thought it was important to check, so you
Well,
audited.
of course.
Yeah. I could see this. And were they usually in compliance?
Very much so. I don't think ever. When I was a land regional manager, there was a few that weren't compliant, and we actually put out of business. And I think back in the late 70s, there were some we even charged, and some went to jail for misappropriation of funds and that. But I can't recall any air operators. There may have been a couple of small air operators that were needed to be watched, if you will. In other words, a more attention needed to be paid to the cleanliness of the back of the airplane because they weren't using it specifically for ambulance work. They were chartering it and doing whatever. But this was all done by our inspectors, our investigators, myself when I was out and about, because our policy was at least once a year we went to the actual bases of everybody on contract, actually went there.
And had a look around? My colleagues wants to ask a few
Certainly.
questions.
Sir, thank you very much. Just want to draw the connection
You have
between...
about 3 minutes left.
Thank you very much. Just want to draw the connection between Ontario Air Ambulance, which was the predecessor to currently what we have, the Ornge Air Ambulance Service. When you were working, you've described some of the mechanisms of oversight that you were involved with at the Ontario Air Ambulance. How much of that oversight system are you aware was translated over into the Ornge Air Ambulance? Or what was the connection in terms of the continuity of those two air ambulance services?
Well, I guess when it actually happened, and I don't recall exactly when it did happen, but I don't think I was at the ministry after. But when I left, there was a manager of the air ambulance program. There was still an investigation branch. And because of the downloading of the land program, I think there was an increase in the complement of the investigators. Because now we became more of the branch became more, instead of an operational role of actually, except for the dispatch centers, which I believe they still operate today across the province, the Central Dispatch Center. I tell you the truth, I don't know. But,
Okay.
after I left, I suspect that they would investigate complaints and continue doing that type of
But
thing.
you were saying that the investigation branch increased the complements of staff because you were not operational anymore, you were more in a role of, and you didn't finish your sentence?
Overseer, I guess. And it wasn't an investigation branch, it was an investigation section in the Emergency Health Services, made up of, I think, 5 people.
And that was for both land and air?
Correct. They looked after not only the complaints, the investigations, worked with the coroner. They looked after the registration and the issuing of ID cards to all the people in the system and what they did and who they are.
So there's a clear connection between the role of the ministry. I mean, there's a clear culture and a policy of the role of the ministry overseeing the work of the ambulance services.
There was.
And so go on.
No, what I was going to say is that it changed quite a bit with the downloading of the land system. We became more of the guardians of the legislation, if you want to call it that, in the sense of we were no longer operating them, but we certainly had the obligation to oversee them.
And can you talk a little bit about your time at Ornge? What your involvement? Did you work for Ornge for some period of time? And what was your involvement at Ornge, and in what capacity?
Well, I was first asked to come to help transfer the Provincial Transfer Authorization Center. This is something that was set up in 1973 during the SARS crisis, where every patient movement between hospitals, nursing homes, so on and so forth, in and out of the province, was screened by the center. I don't know if I'm sure you're aware of what happened with the SARS issue. It was a very, very troubling time. So my job, and that job was given to Sunnybrook to manage the finances of that to the Toronto ambulance service. They had the space because when it was set up, we needed space. We had a room about twice the size of this, 3 times the size of this, that was set up with tables and fax machines and doctors and lay people taking information and transferring it on to the different dispatch centers, because no patient got transferred between a facility without an authorization number. That's how concerned we were at the time. That is continued today, and I think we're probably the only province, because I guess we had a taste of the medicine, that continues to do this with a lot less people, of course. And my job was to bring those staff from Toronto Ambulance, where they worked, into at the time it was the Sunnybrook-based hospital program. And at the time, they were moving from Finch Avenue from their offices to Carlson Court, across from the airport. Anyway, I'll call it Carlson Court. And I went there with the manager of their IT manager, because basically to set up this clearinghouse of patient information. So we went in and set it up similar to a dispatch center, because we had to have contact with every hospital in the province. We had a training I did that for about a year. We trained the hospitals on how to do it online. We developed a very quick computer program for the hospitals, so that they could fill in all the information on the patient and what was wrong with them and where they were going and why. And you always had to have a sending physician and a receiving physician. And in the middle of this, at the beginning of it all, was a physician that watched to ask all the usual questions. And then that information was passed on to the dispatch centers that would send the ambulance. They wouldn't send an ambulance unless they had an authorization number from this center and it's still today the same way. Even flights from outside the country coming into Ontario, the vast majority of them that are carrying a patient call ahead to the PTAC to get an authorization number. So I did that for a year. For the last 3 years that I worked there, I was the manager of occupational health and safety and aviation safety. And my job was to basically set up an occupational health and safety program for the branch, getting people certified in occupational health and safety, doing occupational health and safety audits, which we did, air quality. I was involved in a study that we did. There was a complaint from our Timmins base from the air medics saying that they felt that the jet exhaust fumes were causing some issues, and they didn't know what was in them, and nobody knew what was in them. So we did a study. We hired 2 companies, actually, to do a study of the exhaust fumes, and found that there was no particulates of anything and no anything untoward a human being in these. It's just the smell of kerosene that the pilot would have when he came through the patient compartment. It was an issue.
If I can interrupt you, I think we're about 4 minutes over if we can move to the government questioning.
So that was basically my role. I made sure that the last year that I was there, I worked on what Transport Canada instituted an SMS program, a safety management system program, for all airlines. The airlines were already had them, the big airlines.
You can probably ask more questions when it comes back.
Oh, okay, great.
Yeah. And Ms. Jazz?
Yes, thank you, Mr. Rusk. Just recapping a little bit of your role as Senior Manager of Operations 2000 to 2004. We've obviously established that Land Ambulance was downloaded to upper tier municipalities January 1st, 2000, so you had this oversight role as related to that, but no direct responsibility
Correct.
In terms of the management. You had the oversight of the RFP process as it related to air ambulance.
That's correct.
What about dispatch? Were you in charge of dispatch as well?
Well, the dispatch managers reported to the regional managers. The regional managers reported to the... Pardon me?
Of the land ambulance side?
Yes.
Yes.
Yeah.
Okay.
Sorry. I can't remember exactly. I think there's 15 land central ambulance dispatches
Right.
across the province.
Right.
And there was 1 air dispatch.
So did you have oversight of that as well? Just I'm trying to get the picture of your role here for those 4
As
years.
the senior manager of operations, only to the extent of the managers didn't report to me. They reported to the regional managers of that region. Same as the air program reported to the manager of air. The dispatch for air reported to the manager.
Overall, you were the senior manager of operations. Were you satisfied with the way air ambulance was being administered in Ontario?
Yes. Yes, I saw it grow.
Okay, now to just recap something Mr. Klees, I think, in his questioning, you said that during that time, during those 4 years, knowing that land ambulance had been downloaded, that you weren't involved in any discussions related to possibly some sort of new model for air ambulance? You were a member of Mr. Bates' senior management team?
Well, I think it happened as I was leaving. Quite frankly, we didn't sit down and discuss what we were going to do now.
I see.
I mean,
okay.
You
were not part of any discussions?
No.
When would you have first met Dr. Mazza? As we all know, he was at Sunnybrook Major Trauma Center.
I met Dr. Mazza, I think the second year I was the manager of the air program, so that would be, 96? He was introduced to me as a emergency room physician at Sunnybrook, because Sunnybrook was the base hospital for not only the air program, but for the city of Toronto at the time. And it was becoming quite onerous on the medical staff and their own staff, like it was getting too big for them to handle. So we agreed, the ministry agreed, and Sunnybrook agreed that they would split the base hospital into an air and a land program. So I was introduced to Dr. Mazza at the time as this is the lead doctor to advise or do the medical side of things for the air program.
So
train the medics to do all the that sort of stuff.
Between 1996 and 2004, when you left the ministry, would you have had the opportunity to interact with Dr. Mazza?
Certainly.
On a regular basis?
Sure. Regular,
Did he ever...
monthly, I guess.
Did he ever suggest to you that there might be a better way of administering land and air and...
Well, he was critical of the fact that there were, let's see, 1, 2, 3... There were 6 or 7 base hospitals across the province involved with the air program. He was critical of the fact, as were the other doctors that were in charge. So I met with that group all the time. Well, not all the time, but I think we met every 2 or 3 months. And they felt that there was a need to solidify the air base hospital program with obviously strategic affiliations with the local hospitals and the local base hospitals in each of the areas. So then Sunnybrook became the center for the air program.
So you took that advice to a certain extent then,
Certainly.
in terms of centralizing the base hospital for air ambulance?
Correct. I mean, quite frankly, the training that took place in Toronto and the experience that the flight medics gained by being here in Toronto with the teaching hospitals and so on and so forth had a better exposure, if you will, to major trauma, major illnesses, whereas the farther north you go, even though there are centers of excellence in the north, of course, the exposure to different types of diseases and trauma were far greater in Toronto, and with the teaching hospitals and the University of Toronto, of course, with their expertise. There was a difference, quite frankly, in the training in the outer lying areas, even though there was the dedication. I'm thinking of Kenora in one instance, and I still think one of the doctors still involved there. But they just don't get the exposure. So it was decided, and it was a good idea.
Why did you leave the ministry in 2004?
Why did I?
Yeah.
I retired. It was time to leave.
And who was your next employer?
Well, about 5 months later, I was approached to come and work for Sunnybrook to transport the Provincial Transfer Authorization Centre from Toronto into the Sunnybrook program.
Who approached you?
Well, I guess it was Dr. Mazza initially, but then I dealt with the human resources side of things.
Thank you.
Mr. Zimmer?
So when did you formally join Ornge?
Formally? Well, it was a year after. I was hired on contract first to bring these people over for a year.
Sorry, I didn't hear that.
I was hired on a contract the first year I worked there.
What year was that?
In September of 2004. Sorry, wait a minute.
So in 2004, you went on contract with Ornge?
Yeah, for 1 year. I beg your pardon. I'm not sure of the years now. Okay, they kind of blend together. But certainly the first year that I was employed by them I was on a contract. I wasn't an employee, if you will.
Okay, and what?
And then after that, the human resources people asked me if I would transfer over to full time, to which I agreed to.
So that would have been sometime in 2005?
Yes,
A year later?
yes.
Just a second.
And that was to look after occupational health and safety at the time. And then
So
later...
the first year you were on contract with Ornge. About a year later, you joined Ornge as an employee.
Yeah, it wasn't called Ornge, I don't believe, at the time. I think it was just called the Ontario Air Ambulance Program.
Well, you must remember whether you were, were you working for Ornge or not?
Well, when I left, I was.
Okay. When did you leave?
In 2009.
All right. So you were at Ornge then 5 years?
Sure.
5 years at Ornge. So starting, and then you left Ornge in 2009. Any involvement with Ornge after you left in 2009?
None.
All right. So walk me through the gist of your responsibilities from when you started with Ornge on contract in 2004 to you left in 5 years later in 2009.
Well, as I say, the first year was managing the Provincial Transfer Authorization Center. In other words, setting it up, streamlining it, training for the hospital staff to access it, buying the equipment, and dealing with the computer issues with the IT people, managing the staff.
All right.
Sorry, that was the first year.
What was your, after you joined Ornge, you went from a contract to employee
Full-time.
status, what was your technical title?
I was manager of occupational health and safety.
Ornge.
Correct. You forgive me, I don't know exactly when it changed. I know the name changed while I was there.
Well, you know when the name changed?
Say again?
When did the name change?
When I was there. I'm sorry, I don't know exactly when.
Well, anyway, at some point you were getting paychecks from Ornge.
I don't have any with me to check, but...
No, but you were getting paychecks from Ornge.
Certainly.
Yes, all right. And what was your salary at Ornge?
$90,000, $94,000.
What was your salary when you left the ministry in 2004?
90s, 92, 3, 4, 5, 95,000. I may have been more than that because the last year or two, I think, was when the ministry were paying bonus checks to the certain classifications. So it would have been more than that. But whatever it was posted that 1 year.
At Ornge, did you participate in any of the bonus programs, that sort of thing?
It was
stock options, that sort of stuff?
No. The bonus program was introduced in Ornge the last 2 years, well, the last year and a half I was there. Okay. So I did receive a bonus in 2008. Yeah.
Your disclosure for, just to refresh your memory, in 2009, the disclosure for the previous year, 2004 at Ornge says aviation safety manager, $111,829.82. Does that strike you about right?
I would think so.
And were there options or bonuses or on top of that?
No.
All right. Chair, what time do I have left here?
You have 8 minutes.
Thank you, Chair. Who did you report to at Ornge?
Well, the first year I was there was a gentleman by the name of Steve Farquhar. Mm-hmm. I believe he's still there. The second year I reported to the Director of Human Resources. Mm-hmm. And then I believe Rick Potter became the manager of the air program. And that's when they added on the aviation safety to my role, and I reported to Rick Potter.
And you've heard, or you've been reading the Star, so you know there's a collection of Ornge entities. There's Ornge nonprofit, and then there are various Ornge profits.
To be very frank with you, I didn't.
I'm sorry?
To be frank with you, I didn't know of all these other companies.
Okay.
I didn't.
Which Ornge entity did you work for?
Ornge, that's what I thought I worked for, a company called Ornge, a not-for-profit company.
And was your office up at the Ornge?
My office
was... office up there on the 401?
No.
Where was your office?
On Carlson Court.
Okay.
It wasn't an office. It was a bunch of desks, and one of those desks was mine.
But it was an Ornge office?
It was, correct.
Okay. So I have got your, I guess, your resume that you handed in here, give us, and it's quite extensive, and it's got. Do you have a copy in front of you?
No, but I wrote it.
You wrote it, all right. And my friends have a copy. So I read it through carefully a couple of times, and it's got in great detail everything that you did, different jobs and so forth and so on, and yet I see no reference to Ornge, or I don't see the word Ornge anywhere in your resume. Why is that?
Well, I don't know. Maybe it's a Freudian slip or something. I'm not quite sure.
What do you mean a Freudian slip?
Maybe I didn't want to use the name. Oh, thank you.
Yeah.
I always considered it the Ontario Air Ambulance Program, regardless of what the name was.
But in back and forth to my questions and answers, and in your evidence this morning, you talk about Ornge, and you told me in some detail about your responsibilities at Ornge over the period 04 to 9. You were in Ornge buildings and so on. Surely when you're submitting a resume, and resumes one would expect would be candid, frank. You've got everything. I can read your resume out for the record if you want, but there's tremendous detail in there. Responsibilities, all the various things that you did over the year, and I see no reference to Ornge, and you say it was a Freudian slip that you left a reference to Ornge out. That strikes me as odd.
I'm sorry, it does. There's no malice of intent?
Well,
obviously it's the Ontario Air Ambulance Program is Ornge. I just didn't use the word. Forgive me.
Why do you say obviously it was Ornge?
Well, it's the Ontario Air Ambulance Program, because Ornge was running it.
Well, who are you? Your checks were coming, your paychecks were coming from Ornge.
Correct.
Well, why wouldn't you put in your resume, in 04 I left this and I joined Ornge. You told me in detail that your initial engagement with Ornge.
I guess I made an assumption that would be understood. I put this together. I don't want to keep a resume in my back pocket, so when I wrote it up the other day, I just got a
how
call
would anyone from reading this resume through possibly know that you had worked at Ornge?
I guess you could ask me.
I'm sorry?
You asked me, and I said yes.
Well, why wouldn't you put it in your resume then?
I have no idea. I just didn't. I apologize if it caused you some concern.
Have you submitted your resume to other, places that you might be interested in working or engaging in contract work or anything like that?
No. Well, I did some work down in New Brunswick.
After you left Ornge in 09?
Yeah, started, it was about November of 09.
And when you started that, did you...
Well, I guess I did. Yes, I don't have a copy of it. I'm sorry.
Okay. All right, thank you. So you worked with, you had interaction with Dr. Mazza?
Yes.
And how would you describe your experience, from your point of view, with Mazza? We've heard from other witnesses over the course of these hearings that they had difficult working relationships with MAZA?
I didn't. In fact, my recollection of Dr. Maza was that he had helped our branch during the SARS crisis in the Ministry of Health. He was a dedicated physician. He was well known for his tenacity in his defense of the paramedics. He was certainly, in my mind, I thought he was an outstanding physician at Sunnybrook. And my experience with him at Ornge was that he was the CEO, and there was a board. I didn't know any of the members of the board, and
you've worked with.
You're on your last minute, Mr. Zinn.
Did you consider him an exemplary and effective CEO?
Well, yes, I did.
Thank you.
Okay, I guess we'll move to the opposition then. Mr. Klees?
Well, Mr. Rusk, I have to say that I'm very disappointed that your recollection isn't a bit more crisp of your past experience as a very senior person with the Emergency Health Services Branch and Ontario's Air Ambulance Service.
In what way?
Well, I think, you'll have an opportunity to read the Hansard transcript of the exchanges we're having here. And you yourself, I think, will empathize with us as members of this committee when you read that we're asking you some very specific questions, and your recollection just isn't there. But I'm going to try one more time here. I'm going to assume that all of the things that are on your resume and everything I've heard about you is true. And that is that you were an incredibly competent individual heading up a very important aspect of the Emergency Health Services Branch in our province. That you gave leadership to the air ambulance program, and that you were viewed as someone who is competent and knowledgeable. I'm going to ask you again about your involvement and your contribution to the discussion leading up to the transformation of our air ambulance system. In response to my earlier question about what discussions, or were you involved in any discussions about that consolidation track that the government was on, you said no. In response to questions from Ms. Jazik, you did admit that, in fact, there were numerous discussions that took place in your capacity with the Emergency Health Services Branch, with groups of people who had concerns about certain aspects of the program, and that there needed to be some streamlining, bringing, for example, to your point that you made, base hospitals together, that it was a fragmented system, and so on. That was very much part of that discussion. I'm told, and I'd like to know from you, I'm told that you had a fairly good relationship with Dr. Maza, and that you were actually an advocate for Dr. Maza's plan within the Ministry of Health. Are you going to deny that? Because we've heard it from others. So were you at any point in time in discussions with people within the Ministry of Health, and did you at any time express your support for Dr. Maza's plan of consolidation?
consolidation of the base hospital programs. Is that what you mean?
Well, that was one aspect of it. Dr. Mazza's plan was to bring together the air ambulance program under one roof. That was his plan. That was the Mazza scheme. It involved, the base hospital was one aspect of it. The rest of it was, as reflected in the performance agreement that was negotiated, that would be the platform for the Mazza proposal.
I wasn't. I'm sorry that you have that opinion of me. I certainly wasn't involved in any performance agreement.
Did you ever, let me rephrase it, did you at any time express any sense of support for Dr. Mazza's proposal for what his vision was for air ambulance service in the province of Ontario to anybody at any time in the Ministry of Health? We're under oath here, and we're all listening. And there are people who have come before you, and there'll be people who will be coming after. These are very simple questions.
Well, sir, I must have supported it somehow or disagreed with it. To tell you the truth, I really don't recall. It's been a while. I wasn't involved in the negotiations, or I knew that in my last year, I guess, or 6 or 7 months that I was at the ministry, that this was going to happen. I may have been asked my opinion of it at the time. I didn't think much of it. I didn't think that it needed to be done.
Sir, let me remind you that you were asked your opinion, and you did express your opinion.
Okay.
And that opinion was that you were supportive of what Dr. Mazza was proposing. But let's move on.
You didn't hear your response, Mr. Cleese.
Oh, you didn't hear my response?
No, sorry.
Oh,
it was reported? I'm sorry, I didn't hear what you said.
Yes. Let me just remind you that you were asked your opinion of Dr. Mazza's proposal.
Okay.
And you said he was supportive.
And that when you were asked, you expressed your opinion that it was a good idea.
Who did I tell that to? I mean, Malcolm may have sat me down and said, well, listen, this is going to happen. What's your opinion of it? I may have said, I even read it in the paper that Mel Springman objected to it for a litany of reasons. I don't recall what the reasons were. Believe me, I don't. But certainly at the time, I didn't see anything wrong with it. I mean, I thought that's the way the government wanted to go. I mean, they had downloaded the land ambulance service. Now they were taking the air ambulance program away from the ministry, and I maybe would have been supportive so that I didn't feel like out in left field or something. I truly don't recall.
Well,
if you could show me who it was.
We'll be hearing from Mr. Bates this afternoon.
I'm not trying to hide anything, believe me. I have nothing.
I have to admit to you that I think a number of us around the table are drawing that conclusion. It's pretty hard not to.
I'm truly, truly sorry that you would draw that conclusion.
Okay. Well, maybe, we've got a few minutes left, and maybe we can kind of get this back into focus. It's all in your hands as to whether or not we're going to leave this committee hearing with the impression that you were trying to hide something, or that you were forthright and you're willing to share some information. Now, I'd like to move forward. So you retired from the public service, and you began to draw your retirement pension. And then you took a job with Ornge. Okay. And you started to get paid a pretty hefty sum when you started with Ornge. You were actually getting paid more by Ornge than you were getting paid when you left the public service. So And nothing wrong with that, right?
Well, I don't think it was it? I mean, I'd have to go back and look at my T4 slips, of course. But
well, I thought you had responded to say that. Oh, is that right? Okay. Well, it was 125,000 here, and then 147,000 in 2003. And
that was an account of the Ministry of Health paid us overtime during the SARS crisis.
That's right. That was a big year for everyone.
Truly.
But you did relatively well. So your relationship with Dr. Mazza must have been very positive because he hired you into a very senior position. Aviation safety manager is a very important role. And I'm assuming that during that time, you continued to have a positive relationship with Dr. Mazza. Is that right?
No. The last time I saw him was maybe a week before I left Ornge.
Okay. And when you left Ornge, can you tell me what your severance package was when you left?
$50,000.
$50,000?
$54,000.
And that's pretty substantial for someone to just resign. Why would you get paid $50,000 to retire?
When I retired, they offered me a part-time position to look after SMS, safety management systems, and that's what I was doing before I left, is to convince all the air operators to come together and have one umbrella safety management system. So they offered me a part-time position to do that, and I said, no, thank you. And I said, I'd rather take a severance than work part-time.
But why would you get a severance? You'd only been there for 3 years. Lord knows, we have to work in this place for 20 years, and we don't get that much. You were there for 3 years. Why would you get a severance of $50,000 to retire?
Because I was asked to retire.
So it wasn't your choice to retire. You were essentially fired. Is that right?
No, I wasn't fired. Well, I don't know. You call that a firing? I was told that my position had been made redundant, and that I was offered the position to work part-time, or I said no. I'll take the retirement, but I'll take a severance for retirement because in my mind it was wrongful dismissal.
Can I ask you, when you were there in that very important capacity, and by the way, I'm sure, although you're saying you're not very familiar with what's been taking place at Ornge, but there are a lot of concerns about safety, a lot of concerns about incidents that involve patient deaths, that have put patients at risk. It all comes down to the issue of safety and competence of the entire operation. In the time that you were there, did anything at any time tweak with you that something may be wrong with this organization, that it's not quite efficient, that calls are being missed, that complaints are coming in? Did any of that register on your radar?
Well, at the time that I was there, the contracts were still operated by Canadian Helicopters and Voyager Airways. I don't know when the 139s came into being, but it was certainly after I left. So the program was being run. The only fixed-wing program, once the contract ended with Voyager and the Ornge bought the Pilatus aircraft, I forget exactly what it was. About the last year I was there, I think, that because I was involved in the hiring of the pilots, and that was probably one of my last duties when I was there, hiring pilots to fly the fixed wing. But the bases hadn't started up yet. We were about 6 months, I think, 6 months in advance of hiring the pilots, 4 months in advance,
So
before the bases started.
And you are out of time, I'm afraid, Mr. Klees. So we shall move to the NDP. Ms.
Thank you.
Gellens.
You were in charge of the safety management system while you were at Orange, and that was at a time where the helicopters were being provided by Canadian Helicopter and Voyager Airways, and at the tail end, Orange had purchased their own aircraft, the Pilatus, and you were also responsible for the health and safety, I want to say, but you use a different occupational health and aviation safety for the new aircraft and for the people working on the new aircraft?
I'm hesitant because I don't know exactly when they started.
Did you see them while you were at Orange, the new aircraft?
I saw them before they were put into service, without the interiors in them. And I participated, excuse me, I participated in the interior design for the patient side of things. But I've never seen one finished.
At the time you were now working for Orange, there were people, Malcom Bates being one of them, at the Emergency Health Services at the Ministry.
Oh, right.
Did the Ministry oversee any of this? Like you used to be the overseer doing the annual inspection and visiting the different bases. Now that you were at the receiving end, did the people from the Ministry talk to you? Came and inspect, did what you used to do?
No, I had no involvement with the Ministry people.
No? Did anybody else at Orange have any type of involvement with the Ministry?
Well, I guess it is. I mean, in what regard? As far as the aviation side of things go? Or?
As far as oversight?
Well, it certainly wasn't me, so I don't know who it would have been. Probably Steve Farquhar, Tom Lapine. I really don't know.
Well, but remember you told me that when you were at the Ministry, every year you would go on site and visit the different base that you had, and you told me you physically went. Some of them had problem because the back of the helicopters were not clean because they used them. But didn't the Ministry do the same thing? Come and ask questions about something as important as safety?
They didn't ask me.
They didn't ask you?
No.
Yet
the first year I was the manager of safety in the air side coming into it, was I went and visited every air base that was under contract, every provider, and sat down with them and met with them, and I had a consultant with us to make sure that all the T's were crossed and I's were dotted. And the Ministry of Natural Resources representative came with us as well. We did it over a period of 2 or 3 days.
Okay, but then...
but nobody from the Ministry of Health. I mean, I think I've seen Malcolm 3 times since I left the Ministry. Once at a funeral, once at a retirement, and I think at Chris Maz's son's funeral.
Okay. And but although you were the manager of occupational health and aviation safety, nobody from the government would ever ask you a question about occupational health and aviation safety?
No. Well, except the Ministry of Natural Resources. Their lead person and I continued to work together because I felt that there was still a responsibility to the Ministry of Natural Resources as far as, because they were the lead ministry for aviation. So I kept in contact with them constantly.
And who would, sorry?
What was your communication like with the Ministry of Natural Resources? Who did you speak with and how often?
Well, anything to do with pilot qualifications or aircraft equipment or whatever to do with the air. His name was Ken Wong.
And then how often did you meet with Ken Wong?
Phone probably at least once a week.
Once a week. And then in person?
Maybe 2 or 3 times a year.
Okay. And this was for the entire 5 years that you were at...
No, because the first year had nothing to do with the
that's right. The last 3 years, maybe?
Oh, for sure.
The last 3 years, for sure.
And quite honestly, there was a bit of a quandary even on his side because he didn't quite understand. I mean, I went to him because I felt he was an expert in the aviation side of things.
Can I just pause you for 1 second? I just want to ask you, we'll come back to that in one area.
You have about 2 minutes.
Anyone else, and did you hear of anyone else in the ministry, maybe you didn't deal with them directly, but did you hear about anyone from the ministry doing what you used to do, coming in to check on Ornge's, delivery of patient care or delivery of services or checking on the aircraft?
I saw Malcom Bates and I believe Dennis Brown come into the dispatch center, and they had to kind of walk through our area, and it was a cordial hello, how you doing? A wave type of thing.
And when was that?
Oh, brother.
Or how many times was that? Was that often? Did you see them regularly?
No, I only saw them once. So.
Only once?
Yeah.
Once in between 2004 and 2009. That was it. That was all.
Okay. If I'm trying to be a little clearer than I guess I was earlier, but I mean, if I say once, it might happen 2 or 3 times.
Okay.
I really...
But it was not a thorough check or inspection, or
it was
not
just
to the extent that when you went to the different base, you asked question, you look. He didn't do any of that.
I didn't see them do any of that.
No. And if there had been question about occupational health, aviation safety, would somebody else but you have been responsible to do that?
No. The pilots themselves, but I mean, no.
That was your responsibility.
And I dealt with Ken Wong.
And you dealt with Ken Wong. Okay.
He's the aviation. I don't know what his title is with the Ministry of Natural Resources.
Would you say that the oversight was not there? That there wasn't good ministry oversight while you were at Orange?
I'm tainted, okay, because of the newspaper articles. It's obvious that there wasn't.
But I mean, your personal experience. Do you feel like compared to what you used to do as someone who oversaw the emergency services? Do you think that there was not the same oversight when Orange came about?
Well, I didn't have any reason to ask, quite frankly. I mean, I had left the Ministry of Health. I was doing what I thought was a good job at Orange.
Who told you were redundant?
Rick Potter.
Rick Potter? Did he explain why? That out of a sudden health and aviation safety was redundant?
They had hired a chap from Air Canada who was more qualified than myself.
Who is that?
I don't know. I forget his name.
To do the same thing you were doing?
Well, I don't know what he's doing. I mean, I guess he's looking after SMS and system safety and that.
And you are out of time, so we'll move to the government. Mr. Zimmer?
How much time do I have,
You
Chair?
have 10 minutes.
Thank you, Chair. Do you know Jacob Bloom?
I do know Jacob Bloom.
Did you work with Jacob Bloom?
Beg your pardon?
Did you work with Jacob Bloom?
No. Well, he worked at Orange and I worked at Orange.
And
I knew him.
were you the two of you in the so-called executive cadre, executive suite, that sort of thing?
No. I wasn't in the executive side.
What was your working relationship with Bloom?
He wasn't in my department. He worked in the executive area. He may have asked questions about how did the ministry do this, how did the ministry do that. There may have been a couple of projects that he and I were involved with, not just the two of us, but with other people. I can't recall exactly what it might have been, but it was probably some sort of operational issue that they asked me to partake in. But certainly not a working relationship, no.
Do you know who Tom Lapine is?
Mm-hmm. I certainly do.
Mr. Lapine told us when he gave his evidence that the gossip around the Ornge place was that there was some illicit drugs abuse
I read that
going
in
on, and he specifically referenced Mr. Bloom in that regard.
I read that.
What's your reaction to that?
I was stunned. I was surprised.
That's the first you became aware of it?
Absolutely.
And no knowledge of illicit drug or cocaine, anything like that?
No, I mean, it just, I totally surprised.
What in your working relationship with Mr. Bloom, to the extent that you interacted with him on a professional or management basis, what was your opinion of his management style?
I don't think he managed anybody, quite frankly.
What was your opinion of his...
He was kind of the advisor, I suppose.
Advisor
to the senior group, I suspect. I don't know what his... I probably did know his name or his position, but I don't recall what his position was now.
You used the expression, I think, in answer to some line of questioning from Mr. Klees about your the events surrounding your when you left Ornge, and that you were offered a retirement gratuity rather than a part-time job that they wanted you to take, and redundancy, and finally used the expression that you viewed your departure as a wrongful dismissal.
Well, that's what I told them.
Okay, so why were you of the view that your departure amounted to a wrongful dismissal?
Because I didn't want to retire at the time.
And, well, why did they want you to retire?
Because I was 65. I guess they thought that I had to retire, and I didn't think I had to.
But these are the same people that, in effect, offered you a contract for a year or so with Ornge, and then took the initiative to move you from a contract basis to permanent employee, and gave you serious responsibilities, aviation safety and all of that. What happened that made them decide that, okay, it's time for you to get out?
Brother.
Something must have triggered that, and something must have triggered your thought that that amounted to a wrongful dismissal.
It took me by surprise, quite honestly. I was hoping I could still do some work and to be part of the air program. So when I gave it some thought, I just basically said, what you're doing is pushing me out, and you can't do that, and at least I thought you couldn't, and so.
So what, in your view, triggered? I mean, you started off with what seemed to be a pretty good relationship with Dr. Mazza. You described him as an exemplary and an effective CEO, and you said you were quite taken with his what he wanted to do on air ambulance and at Ornge, and then somehow the relationship soured and they wanted you out. What's your theory? What went on there?
I have no idea.
All right.
I think they.
Right,
let me answer that. I think they were looking for more of someone who was a professional in the aviation business. They weren't looking for somebody who had a historical value, because I think they had passed that, quite frankly. And I think when they started bringing in people at the time. In the aviation department, these were people that were involved in the aviation industry, and so I suspect that they felt my time was due, I guess.
And when you say they, I gather the effective decision maker on that was Dr. Mazza.
Well, I dealt with the human resources people, and I'm sure Dr. Mazza was involved with
Yes,
with
right,
that.
because we've heard Dr. Mazza was very much a hands-on guy. So I listened to your answers now, and I detect that you a certain frustration or disappointment, indeed anger at how the Mazza organization treated you.
Well, up until that point, yes.
Yes. So in my earlier round of questions, however, you did describe Mazza as a exemplary and effective CEO. and I'm having trouble juggling these two views. On the one hand, you said they pushed me out.
I can understand that
wrongful.
now.
I felt I was wrongfully dismissed. Mazza was in effect, the guy behind all of that.
Yep.
And then on the other hand, you say, well, no, he was an exemplary and an effective CEO. I'm having trouble reconciling your view of your relationship with Mazza and your view of Mazza's skills and defects.
Well,
Help me sort that out in my mind. You're all over the map on this.
Well, it's very difficult, I mean, he was a physician. I've always looked up to physicians in my career. He presented well. He came in to help the ministry during the SARS crisis. Even he helped after the 9/11 issue. I mean, he was front and center and ready to go to help in the United States as backup to their system going to New York. I saw a lot of the good things. I'm sorry. But you've had the benefit of listening to an awful lot of people. And I've had the misfortune, I guess, to read about it in the newspaper where I'm sure it's slanted some way. I mean, it's a little bit, but...
So I come back to my last question again. So Ornge, over a period of 5 years from 04 to 09, was a big event in your life, and yet in this detailed resume, no reference to
Well,
Ornge.
I think, actually, I said this to Mr. Klees when he phoned me last week, or it was last week, that I'm embarrassed.
And
To
why are you embarrassed? I'm not saying you've thrown it.
because of this, because of the reputation that I think I have with the private ambulance operators, the air ambulance.
If you were applying for another job tomorrow in answer to an ad for someone with your skill set, would you tell them in your resume about your Ornge connection?
Certainly I would. I mean, I'd play it down, believe me. I think I have a lot more...
Thank you. My colleague wants to...
I mean, and that puts me in... I know it may put me in a bad light with you folks, but I was there trying to do the best I could and working with the people there. The people that are still there, the worker bees as I call them, they're good people and they do good work every day. And to read about it in the newspapers, believe me, when I say I don't like reading about it. And as I said to Mr. Klees, I'm truly embarrassed that I was there. I just truly hope that, and this will come at the end of all this, I suspect, that it will be back up on the same level as it was that when I knew it, because like I think Mr. Klees said that the father of it. Well, I don't consider myself the father of it, but I was certainly instrumental in the starting of the program back then, and it's come such a long way, and to have it dragged through the mud because of this one person, and maybe many others I don't know, but certainly this one person. It's hurtful, to tell you the truth.
Thank you.
Ms. Sandals, if you want a couple minutes.
A couple of minutes. I wonder if we could quickly go back to the time when you were with the ministry. You talked about the base hospital program. As the manager of air ambulance, did you have responsibility for the base hospitals?
For the air base hospitals? Yes. Like when you say responsibility, not the day-to-day operation of it. It was a funding issue with the hospital that they worked for.
So you would have been, you would have had involvement with the budget and engaging the base hospitals.
I was.
Okay. I also want to recall a comment you made. So it could, and something just occurred to me. You said you were talking to Mr. Klees last week. Could you tell us about that?
Certainly. He just gave me a phone call and asked me if I'd accept an invitation to attend this committee meeting. And I said, well, I'd be happy to help in any way I can. I said, I don't know whether or not I can.
Because normally it's the clerk that engages you to appear. So how was this sort of a pre-interview to find out what you might have to say?
No, he didn't ask me any questions like that. He just wanted to know if I'd be willing to accept an invitation.
But you got into a discussion of your feelings about Ornge.
I told him that I think I may have said I was embarrassed because because of the goings on.
And you are out of time, so.
I think it's clarify this. The clerk had advised us that he did not have contact information for Mr. Rusk. I believe that message went around to all of the committee members. We took it upon ourselves to do some research. We located contact information for Mr. Rusk. I gave Mr. Rusk a phone call in the interest of assisting the committee.
Very well. And thank you very much, Mr. Rusk, for coming in this morning.
You're more than welcome.
To
I would just like to say one final thing.
Go ahead.
Please don't misconstrue anything I've said in the sense of I'm trying to hide something. I never have in my 40-some-odd years working in this business, if you want to call it that. If it's something that I've left out, it's only because I certainly don't recall it. It's been 9 years since I left the Ministry of Health. I've never been back. It's been 3 years since I left Ornge, and I've never been back. And I still get a lot of phone calls from the private air ambulance operators asking me would I be interested in coming back and working with the air ambulance program again. I'm 68 years old. I think it's time for me to do some other things. And I'm happy to help. I've done a lot of, I call it pro bono work with some other ambulance services, some software companies that are interested in making electronic charting for the air programs. And I still attend the conferences that happen in the United States. It was my life, and I was very privileged to take part in it, as well as being in charge of the health needs for all the heads of state and internationally protected persons for 19 years. I've worked with the RCMP and the OPP, with Crown attorneys during my career. I'm always surprised, truly, I'm always surprised when something goes amiss. I have a high trust relationship with a lot of people in this province in the ambulance industry, and I know bad things can happen. And just make sure, and I'm just saying this from the bottom of my heart, just make sure whatever you do, and whoever does it, retains the air program in this province. There are so many people that their lives have been saved and their lives have been affected by these people that work on these air ambulances. It goes without saying that I'm sure that will be your conclusion in the end, because there's been a lot of changes, obviously, in the last 6 months. So thank you very much, Mr. Klees, and this committee for inviting me here today. And please, I'm happy to be here.
Thank you, and thank you for coming for the meeting. We're recessed till this afternoon.